So my project is looking at factors that impact the age of ASD diagnosis. So autism spectrum disorder, or ASD, is characterized by differences in social communication and social interaction across multiple contexts. And it is also characterized by restricted and repetitive behaviors or interests. So the age of diagnosis is important because it determines how early a child will have access to different services and support systems. So the earlier an autistic individual gets diagnosed, the earlier they can have access to services like early intervention, which has been associated with improved outcomes in cognitive functioning, school placement, and overall quality of life. And there has been an increase in prevalence from 1 in 150 children getting diagnosed with ASD as of 2002 to 1 in 54 as of 2016. So although the average age of ASD has decreased over time, there continues to be disparities in the age of diagnosis due to different factors. So sociodemographic factors such as race, ethnicity, and socioeconomic status have been found to be associated with different ages of diagnosis. So autism surveillance studies have indicated that Black children are diagnosed with ASD on average 6 months later than white children. These same studies have found that although prevalence rates are similar between Black, white, and Asian children, Latinx children are still being diagnosed at lower rates and have a later diagnosis overall. And then lastly, children from low socioeconomic households are less likely to get diagnosed and also have delayed diagnoses. Symptom severity is also related to the age of diagnosis. So previous studies have found that children with severe language deficits, increased repetitive behaviors, early developmental regression, and severe cognitive impairments were associated with earlier ages of diagnosis. And guarding concern of initial symptoms have also been found to lead to an earlier ASD diagnosis. So if initial symptoms are more severe and the concerns are more related to atypical social development, then parents are more likely to raise these concerns with their primary care providers. And family interactions with the healthcare system prior to a diagnosis is also associated with the age of diagnosis. So children were found to have an earlier diagnosis if the guardians also reported having more positive interactions with the healthcare system and a higher frequency of interactions. And then distrust in the healthcare system can also impact the age of diagnosis. So distrust is influenced by racial disparities in health, limited access to healthcare, and negative encounters with healthcare providers, all of which can impact how willing a parent or guardian will be to seek attention or services for their child. And distrust in the healthcare system stems from a long history of maltreatment of BIPOC individuals in the community as a whole, in healthcare settings and in medical research and treatment as well. And overall, this distrust has been seen, continue to be evident in different disparities across the medical field. So a recent study found that Black families were more likely to express distrust of healthcare overall and of specifically autism-related encounters. And Black families were also found to be more watchful in healthcare settings because they couldn't assume that their child would be treated equally, and this resulted in delays of diagnosis for their child. So this study aimed at understanding how these factors impact the age of diagnosis while expanding on the current SES measures. So previous studies focused solely on objective measures of SES, while our study also included subjective measures. So objective SES is seen as one's economic and social power in relation to others, and this is often measured through education level or household income. And then subjective SES is one's own perception of your economic and social position in relation to others, and this can account for more personally relevant individual characteristics like race or gender, and how these characteristics intersect with advocacy for healthcare needs. So there are three main hypotheses that we aim to examine based on this past literature that I kind of went through. So the first hypothesis is that high SES, high symptom severity, high guardian concern, and high frequency of family interactions prior to a diagnosis will result in an earlier age of diagnosis. Secondly, was hypothesized that BIPOC individuals will have a higher mean age of diagnosis compared to white children. And lastly, was hypothesized that high levels of distrust in the healthcare system would be related to a later age of diagnosis. Participants were guardians of children who have been diagnosed with ASD in the last 5 years and live in the US. There were a total of 65 participants. Participants were recruited through Research Match, which is an online recruitment tool used in academic and medical settings. And they were also recruited through URMC's Developmental and Behavioral Pediatrics Research Registry and social media pages. So the participants anonymously completed the REDCap survey. There's no compensation and it only took about 10 to 15 minutes to complete. So statistical analyses was done using SPSS and descriptive statistics were generated on all variables. To assess our correlational hypotheses, experiments correlations between the age of diagnosis and the family and child characteristics were performed to examine how these factors impact the age of diagnosis. And to compare the mean difference of the age of diagnosis between the white sample and the BIPOC sample, an ANOVA was performed. So the participants completed a total of 8 measures. The first one is the Revised Healthcare System Distrust Scale, which consisted of 9 Likert-style items. And then we have 2 examples on the right there. The first one is healthcare systems put making money above patient needs. And the second one is healthcare systems give excellent medical care. Next measure is the MacArthur Subjective Social Status Scale, and it was used to measure subjective SES. And this scale is a single item measure that assesses a person's perceived rank relative to others in their community, as seen on this social ladder, with rung 1 being low status and rung 10 being high status. For family income, it was collected through this bracket with 16 possible options. And the guardian education level was collected through the following categories, and we got all categories accounted for. And child symptom severity was collected through guardian reported scale of key ASD characteristics, which included repetitive behavior, social communication, and daily functioning. The scores for these 3 characteristics were averaged for a total symptom severity score with a total possible range from 0 to 100. And guardian interaction with the healthcare system prior to a child's diagnosis was measured by self-reporting the frequency of healthcare visits before a child's diagnosis in the last 10 years. And guardian concern of child's initial symptoms was reported by degree of concern for various types of concerns. So an example is when you first experienced social concern for your child, how worried were you? And then with higher concern, indicating a greater number concern and greater overall worry. And lastly, there were 2 open-ended questions allowing for guardians to add any relevant information regarding their child's diagnostic process. And the 2 questions were, are there other factors that you believe impacted your child's diagnostic experience? And is there anything else you would like us to know about this experience? So the guardians reported demographic information on their children, which included the child's sex, race, ethnicity, and current age. About 75% of the participants were males, and about 26% were female. And the sample was about 75% white and 25% BIPOC. And the current age of the children ranged from 2 to 22 years old, with the average being about 7. And the guardians also reported their subjective SES. So responses on this measure were normally distributed and ranged across the full scale. And for objective family income, it ranged from 100,000 or 10,000 to 150,000, with the mean income being about 100,000 to 199,000. And objective guardian education ranged from some high school to professional degree, with master's degree being the most common. So our sample, which is seen on the left part of the screen, there was 26% of autistic individuals identified as female, which is similar to recent surveillance studies that have found about 23% of individuals identifying as female, as seen on the right. And the sample's race and ethnicity percentages differed a bit from the national sample. So our sample had about 75% white participants and 25% BIPOC individuals, while the sample for national surveillance studies had about 54% white and 46% BIPOC. So the mean age of diagnosis for the sample was about 6 years and 3 months, while the national average is about 4 years and 3 months. That means that our study participants were being diagnosed on average 2 years later than the national average. And the range for the diagnosis was from 1 year and 3 months to 17 years and 11 months, which is a lot wider than previous studies as well. So overall, the results from the Spearman's row correlations did not support the predicted hypotheses, with the exception being the correlation between the age of diagnosis and symptom severity. So as hypothesized and supported through previous research, high symptom severity was related to an earlier age of diagnosis. Another finding is the correlation between subjective family income and the age of diagnosis. So there was a trend towards a significant correlation between the age of diagnosis, but it was contrary to our hypothesis. So the results indicated that the higher family income, the later the diagnosis. So again, the first finding was that higher symptom severity was related to an earlier age of diagnosis. And this is pretty supported in past research. And this could be because physicians and families are more likely to notice more severe symptoms, especially those that are more autism specific, like repetitive behaviors and social communication abilities, which were characteristics that we looked at in our symptom severity measure. And the second finding is that higher subjective family income was related to a later age of diagnosis, which is not what our hypotheses predicted. So one possible explanation for this finding is that families with higher perceived income are more likely to persist in getting a diagnosis for older children. So specifically our sample, we had a very wide range for the age of diagnosis, where previous samples, especially surveillance studies, aim at looking at more early childhood and early diagnosis. So families with lower perceived income may not have the necessary resources to pursue a diagnosis, as it could take many visits and follow-ups, and they could potentially result in a misdiagnosis. So one limitation is our recruitment method. So we recruited through URMC's Developmental and Behavioral Pediatrics Research Registry and social media pages. So this means that families with high distrust in the healthcare system may have been less likely to participate in our study. But after analyzing the distribution for distrust in the healthcare system measure, it was found to be normally distributed and similar to previous studies. And then another limitation of the study is the number of participants and the diversity of the sample. So the sample had less diverse racial and ethnic groups than the general public and previous studies, and had a lower number of participants overall, which could have limited the effect of the study results. So for future directions, continued efforts to examine the impact of these factors on the age of diagnosis in diverse and representative samples is important to help improve healthcare efforts and reduce disparities among the autism community. Thank you guys for listening, and especially thank you to my advisors for all your help and support.